Welcome to our presentation on Intensive Behavioral Intervention, also known as IBI. This presentation has been created by Rebecca Best, Anita Bennett, Amanda May, and Jason Falat. Before we jump into IBI, to activate your prior knowledge, we will review some key concepts that pertain to autism spectrum disorder, ASD, and help to build an understanding for why IBI is important. Let's begin. What is autism spectrum disorder? ASD is a complex developmental disability that typically appears during the first 3 years of life. ASD is a neurological disorder, or a brain-based disorder, that affects the functioning of the brain. When an individual receives a diagnosis of ASD under the DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders, the most recent one released in 2013, they have symptoms falling under two categories: challenges with social communication and social interaction, and restricted repetitive patterns of behaviors, interests, or activities. Due to the challenges faced by individuals with autism, IBI therapy is often chosen by families to support the development of their child. Although IBI therapy can assist a variety of people, it is extremely effective for children meeting the criteria for autism spectrum disorder. IBI has a much stronger empirical basis than virtually any other intervention used with children with ASD. This means that IBI has proven to work better than most of the other types of interventions used to support the development of individuals with ASD. Although individual results may vary with treatment, we will discuss this more later in the presentation. What is IBI therapy? Intensive Behavioral Intervention, or IBI, is an intensive way of teaching your child new skills in all areas of development through intensive and reinforced practice. We will watch a short clip of an IBI therapy session for a 5-year-old boy learning to match. While watching the video, pay attention to the reinforcement method used in the treatment. Reinforced practice. IBI relies on the skillful use of positive reinforcement procedures. Positive reinforcement is used to internalize appropriate behaviors. Possible reinforcers include things to play with, watch, eat, or drink, although there's some controversy over using food and beverages as reinforcers. The families of individuals with ASD will work with the behavioral therapist to identify reinforcers that will specifically be used in the program. Through time, children are taught to choose the reinforcer that they will work for. For example, if we refer back to the video, the 5-year-old boy from the video choosing the piano as a reinforcer for completing a matching task. Another important aspect of IBI programs is that they are intensive. Typical IBI programs are a minimum of 20 hours a week, but some can range up to 40 hours a week. Why is this important? Perry, 2002, looked at intensity of programs in terms of hours per week attending IBI programming. He found high intensity IBI so 20 to 40 hours per week, was associated with improvement in IQ scores. He also found that low amounts of IBI, so less than 10 hours per week, were ineffective or even negatively affected IQ scores. The duration of treatment is also related to the outcome, with recommendations that treatment be provided over years rather than months. Duration of treatment also impacts results of treatment. Research suggests that individuals with ASD attend treatment for the long term, so over years. IBI therapy is offered by trained professionals across multiple settings. It can be provided in a clinical setting in individual treatment rooms, so therapy is one-to-one. It can be provided in a community setting within small groups, or within the comfort of a child's home. It is important to understand the difference between ABA and IBI, as these supports are quite different, but often confused to be the same. So applied behavioral analysis, or ABA, a process to identify functional relationships between observable behaviors and environmental context. Observers may observe a behavior and then look at what happened immediately before and after the behavior to understand what the function of the behavior is, what is causing and reinforcing the behavior. ABA uses information gathered to design interventions to target behaviors, so reduce problem behaviors or elicit desired behaviors, and achieve meaningful, generalizable, and enduring behaviors. Intensive behavioral intervention, or IBI, refers to the application of principles of the ABA in an intensive setting to result in behavioral changes and improvement. So the differences between ABA and IBI that should be noted include that ABA can be incorporated in regular school routines, whereas IBI is primarily provided in one-to-one or small group settings and has a low ratio. ABA can be implemented by classroom teachers and support staff. IBI is delivered by trained behavioral therapists and supervised by psychologists. ABA provides a framework for ongoing skill development. IBI includes learning to learn behaviors like imitation, cooperation, and attention, and uses a specific intensive format. Now we will look at a parent's perspective of IBI. This video looks at the HAND Autism program that helps children with autism across northeastern Ontario.
Every skill they have touched on in IBI, he has just excelled in. There's no other program like it that can really turn it around like that and be that one-on-one and intensive and really get to know your child and really be like, hey, this is where he needs to focus on. Working with the HAND Autism team, always kept in contact. Overall, it was just such a great environment. I know sometimes as parents we're always wondering, are we doing the right thing? Is it the right program? Are we pushing them too much? But out of everything, especially up north, this is like the best program. You'll never get that kind of, intensity and one-on-one and people that really understand your child like the IBI program. You go to IBI and you talk to the staff there and, they talk about your child and you're like, wow, you get it. You get autism. You get my son like nobody else does except for his parents. If it wasn't for this program, my son wouldn't have excelled the way he did. And before we started IBI, I would always think, like, my child is never going to hit his milestone. Once he started IBI, they really opened up my eyes and showed me, like, he will do it. It's just on his own time. He will hit his own milestone, and he's going to be like a typical child. It's just going to take time. Because of IBI, he has done a lot of things that I didn't think he would, back when he first got the diagnosis.
The goal of IBI. The main goal of IBI is to change a child's developmental level. This graph was used by Hamilton Health Services in their parent information package titled Intensive Behavioral Intervention from Your Local Agency. It shows where a neurotypical child may be in terms of their developmental age and chronological age. and where a child with ASD may be in regards to their developmental age and chronological age. The goal of IBI is to bridge this developmental gap and increase developmental trajectories. This graph does a good job of showing the ideal outcome of IBI. However, it is important to keep in mind children have different outcomes with IBI treatment. While some make very good progress, others show slow to minimal progress. The neurological explanation for this developmental catch-up, which is the goal of treatment, is unknown or unclear. However, the concept of neuroplasticity of the brain with intensive training has been well illustrated. Targeted developmental areas. IBI targets a broad range of developmental areas. It follows a sequence focusing on skills in the order they would tend to appear in a neurotypical child. IBI is designed to improve key learning skills in the areas of cognition, language, and social development. When examining research on the impact of IBI on social, emotional, and academic functioning, success of IBI is believed to correspond to the intensity and duration of treatment. Some of the impacts include substantial gains on standardized tests of cognitive ability, successful functioning in mainstream programming, indistinguishable from neurotypical children of the same age. Significant effects were found for cooperation, receptive language, social interaction, play, and leisure. Early intervention. Scientific evidence shows that children with ASD between 2 and 5 years of age derive the greatest benefit from IBI treatment. This is likely due to the fact that their brain has more plasticity during this developmental time, and they have the opportunity to have more years of intervention. EIBI, or Early Intensive Behavioral Intervention, assists children living with autism, aged 2 to 5 years old. They complete 20 to 40 hours per week, which helps build wide repertoire of skills in the child up to about a junior or senior kindergarten level. EIBI can prove to be very important and effective in modifying or eliminating many of the most severe symptoms. Most of these include social skills, compliance, rituals, and communication. Like IBI, EIBI can be provided in a variety of settings. We will watch a short clip that explains EIBI.
Research shows that children who receive behavioral intervention early and intensively are more likely to have improved long-term outcomes. These services can maximize learning potential by addressing communication, play skills, problem behaviors, and overall development from a very early age. We know, through research, that the brain's plasticity, the brain's ability to change and learn new skills, decreases with age. When children are very young, their capacity to develop is greatest. When this plasticity decreases, it becomes more difficult to learn new skills and change ingrained patterns of behavior. This is not to say that individuals with autism are not able to learn new skills if intervention is not started by a certain age. The brain of an individual with autism is much like everyone else's, capable of learning and using new skills and information at any time.
Transdisciplinary team. People that may be involved in the IBI process include a senior therapist, instructor therapist, clinical coordinator, psychologist, ABA therapist, speech therapist, parents, and family. Studies on the effects of IBI therapy have varied quite significantly. In one study, a large proportion of children, up to 47%, achieved normal intellectual and educational functioning at the end of intervention. Another study showed that 75% of children showed measurable progress or improvement. Another study found that even after intensive IBI, no child in their sample had recovered, and all still needed ongoing educational assistance via aids or special education provisions. It is still uncertain to the degree that individual children will improve as a result of IBI. Research suggests that children with higher initial IQ and children who begin early are likely to do better.